Hello, I am Bridget, ward pharmacist.
Hi, I am Amy, the ward nurse. Daniel had a severe hypo in the morning. I am monitoring his blood glucose levels.
Let me start my work with his drug chart. Oh no. Wrong insulin.
Hello, I am Brian, the registrar. What went wrong?
Ward FY2 has prescribed insulin incorrectly. Patient is normally on Humulin I, 6 units twice a day. FY2 has prescribed Humulin 6 U. Pharmacy has dispensed Humulin S, which was given by the nurse. She has given him 64 units, which has led to a severe hypo.
What? I will talk to the FY2. William, I need to talk to you.
I know what it is about. I have only missed I in the prescription and written U instead of units. Insulins are too confusing. I need some more training, please.
Okay, why don't we look at the standards for insulin prescribing? There are some aspects of your prescription which are correct, but not all. Shall we look at some insulin top tips today? First, you should know the type of insulin you are prescribing. It can be a quick-acting or mealtime insulin. Or it could be a background insulin. Or it could be a mixed insulin, which is a combination of both quick-acting and background insulin. For instance, Humulin S is a quick-acting insulin, Humulin I is a background insulin, and Humulin M3 is a mixed insulin. So, always write the full name of insulin. What next? You should know the source of insulin you are prescribing. It can be animal insulin, or human insulin, or analog insulin, which is structurally altered insulin for better absorption. Animal insulins are rarely used these days, so we will focus on others. You should know which insulin you are prescribing. There may be hints in the names. There are different types and they may act differently. Always prescribe quick-acting and mix insulin with meals. But remember, compared to analogs, human quick-acting and mix insulin are slow to act. Hence, a patient on human insulin should wait for 30 minutes before he eats. Even the duration of action depends on the source. For instance, human background insulin doesn't last as long as analog insulin. So, know the source of insulin you are prescribing. Standard insulin strength is 100 unit in 1 ml. Beware of higher strength insulins which are twice, thrice or 5 times stronger. Check the strength of insulin when prescribing. Most important, never write U. Always write units when prescribing insulin. And finally, after prescribing insulin, allow patients who are willing to and able to continue to self-manage their insulin while in hospital, in line with your trust policy. So William, what went wrong when you were prescribing?
I know it now. I did not write the full name of insulin. This meant that the wrong insulin was dispensed and given. I did not write units, which led to a huge dose error. So, instead of 6 units of background insulin, patient had 64 units of quick-acting insulin, leading to severe hypo. I should have followed the correct standards.